finish CPR and drug administration. Okay, so week 3. And then later, okay, if somebody still comes, still somebody coming, no more. Test, right? Remember, I asked you to study 10 points, okay, later on, okay? So let's finish this topic first, okay, CPR, okay, after this one. Okay, so we now go to CPR, okay? So what does CPR stands for? So cardiopulmonary resuscitation, okay? This is also known as your BLS, okay? Sometimes we call it BLS, okay? The basic life support, okay? So remember, failure to institute ventilation, okay, within 4 to 6 minutes, okay, will result to cerebral anoxia in the patient, okay, and eventually brain damage, okay. So remember that. It's important for you to start CPR within 4 to 6 minutes after the oxygen is cut off from the brain, right? Because brain can die easily, okay, within 4 to 6 minutes, okay. The brain tissue will die, okay, without oxygen, okay. So it's important to start CPR immediately, okay, so that you prevent these two complications, okay. Anoxia meaning A, no oxygen, okay, and okay, no oxygen to the brain, okay. Okay, so remember, cardiovascular disease is the #1 cause of death, right? It's not cancer, okay, so cardiovascular, okay. Sudden cardiac arrest occurs during 1 hour after the heart attack, okay, and more than 2/3 do not reach the hospital alive, okay. Imagine that, 2/3, about 66% will not be able to reach the hospital alive, okay. Death will follow unless emergency treatment is provided immediately, okay. And remember this, the most common cause of sudden cardiac arrest in an adult, okay, is what? Everybody read. Ventricular fibrillation, okay. So remember that. What does it mean? Okay? The ventricles are shivering like that, eh? The ventricles should contract all at the same time, right? All the muscles like that, right? So that blood will come out, right? But we say fibrillation, so it's just like shaking, okay? The muscles are shaking without effective pumping of the blood. So what happens with that? The blood will stay there, and then you will form clot, right? And then the clot can grow to the brain or to the heart, okay? So remember that, okay? So the most common cause is your ventricular fibrillation. Look at this, okay? These are the causes of sudden death in the United States. #1, keep that in mind, okay? It's a heart problem, okay? So ventricular fibrillation, okay? #2 will be your electric shock, okay? Drowning, okay? Drug overdose, trauma, suffocation. What do you mean by suffocation? Cannot breathe, okay? When you try to kill your friend, like that, suffocate. Or when you put your plastic bag, okay, over your head, okay, or you put like something in the nose and the mouth so the patient cannot breathe, suffocate to death, okay. Next will be stroke, and then lastly, okay, insect bite, okay, maybe anaphylactic reaction, okay, allergic reaction, okay, to the insect bite. Okay, so what are the requirements for your basic life support? So you only need 3 things: your lungs, your hands, and your brain to think, okay. Okay, so why should you learn CPR? Okay, #1, this is the reason why. Everybody knows CPR, right? Because we are nurses. So someone you love is suffering from heart disease. So you should learn how to do CPR, especially if your relative or your father or your mother have heart disease. So it's important for you to know, okay, CPR. Okay, next, the nature of your job, like us, nurses, okay, requires that you be prepared to handle medical emergencies. That's why it's included in your curriculum, okay? When you study nursing, okay, you need to know CPR, okay? And then lastly, you believe that knowing the skills of CPR makes you a more useful member of your community, right? Not everybody knows how to do CPR. So if you know how to do it, you are more useful than the other people, right? Because you know something that they don't, okay? So what are the elements of your basic life support? Okay, so always maintain the airway open, okay? So maintain So we use this word, okay? Patent airway, okay? When you hear this one, okay, meaning to keep it open, okay? Patent means open, okay? Maintain patent airway, okay? So meaning keep the airway open, okay? Support the breathing, okay, of the patient and support the circulation. That's why you blow to the victim, okay? Because you want to support the breathing, okay? Because the patient is not breathing on his own. And then you should support the circulation. That's why you do your chest compression, okay? To circulate the blood all over the body, okay? So remember, there's no equipment employed. It's cold here because there's exhaust. Nobody wants to sit here because the exhaust is here. So it's a little bit cold. Okay? So no equipment employed. Okay? So you don't need any special instrument. Okay?